Another important role these exchanges are supposed to fill too is just communications directly with employers. So I mean, the employers now, of course, under our current system, work with someone like Scott, put in a health plan and can change that plan, or the providers they work with if they want to. But you haven't really had to communicate with a governmental entity or someone that's sort of acting on behalf of the government, like these exchanges are supposed to do once they're in place. So once they're in place, though, there will be information that employers, as sponsors of their group health plans, are going to need to provide certain information to the exchanges about their the health plans that they sponsor. And likewise, the exchanges are going to be providing certain information back to the employers, the plan sponsors too, regarding particular employees that are covered. You'll be reporting information, really, protected health information, to use a HIPAA type term, as who's individual employees that are covered and so forth. But that kind of information exchange will help employers determine too whether or not some of their employees are low income to the point that they are can't afford the employer provided health plan coverage. Why does that matter? Well, it relates to one of the penalties later on that Tim is going to talk about. So it's a way that Congress is trying to encourage employers to make their plans affordable and cover everybody, that not just the majority of their workforce, but if they leave off, if their plan is kind of out of the price range of some of their low income employees, the employer may end up getting penalized. So there's some not just a carrot approach, but the stick approach to trying to get employers to have plans that are going to cover as much of their workforce as possible, even the low-income people, in order to avoid those penalties. So for the employer to know if they have such employees, I mean, they have a general sense of their workforce, but they don't necessarily know if that person is going to be qualified. So their income is so low as to qualify for that premium tax credit I talked about before. The way the employer will know is because the exchange will tell them. Because the exchange, remember, is the organization, is going to be the entity that certifies or determines that someone is eligible for, because their income is so low, is eligible for the premium tax credit. So the exchanges are going to be communicating back with employers and saying, employees A, B, and C of yours are qualifying for this premium tax credit because their income is so low. You, employer, take from that what you will. I mean, if you then, are going to make the plan more affordable to them so that they don't have to get the insurance off your plan and go to the exchange and buy it individually, then great. Then the system has sort of accomplished part of what they're trying to accomplish. But if you and the employer decide to just leave things well alone, maybe pay a penalty and let them do that, that's fine too. Bottom line, the employees are going to be encouraged one way or the other, if they can't afford to get the insurance coverage through their employer, to get it individually through one of these exchanges.
Ryan, would you say that the exchanges, the so-called exchanges, are sort of what the so-called public option ended up being?
That's a good question. I do think that these exchanges are, what are something analogous or close to what the public option, was intended to be in earlier versions of the healthcare reform. It's not the same thing as a public option, and yet there's certainly an analogy there. Yeah.